side effects of some of these drugs can be increased suicidal ideation. There's a recent black box warning by the government that giving these drugs to children and adolescents could increase suicidality. The facts are that's true.
Early 90s, there was a huge spike in children being diagnosed ADHD and subsequently being put on Ritalin. At that time, several things happened. The federal government awarded schools more money based upon more children being diagnosed ADHD.
According to my therapist, the Prozac was supposed to sort of give me a boost, get me out of the low place I was at. At first I was resistant to it, but she said that just because you're on it, you know, it doesn't have to be forever. That a lot of people take it and they develop better habits. And, you know, they're able to move on with life and eventually wean themselves off of it and not be depressed anymore. That's what it was supposed to do. I remember being put on the stretcher and taken out. I remember being outside and feeling like, just knowing like, okay, like there's an ambulance and I'm on a stretcher. I was just terrified. And I remember I'm in the ambulance and my parents are in there and I'm just really scared. And I went and got to the hospital and I was examined by the doctor. And then they took me to a place, you know, armed guard, like very dark, weren't allowed to leave your room. So I was in that place, I don't even really know for how long. And we were sort of coming to, I guess, when I was there.
He became violent.
I almost killed my friend because of his haircut.
He literally flipped out over the fact that the boy next door had a haircut that he didn't like.
When you look at the widespread use of these mind-altering drugs among children, is where you're going to find the answer for the violence that we're seeing in children today.
He had no control. He came to me in the bathroom and he said to me, "Mom," he goes, "make it stop. I can't control myself. I don't know what I'm doing. Make it stop."
We have a great amount of evidence in the scientific literature that antidepressants and stimulants cause abnormal behaviors in children, in particular out of control, aggressive behaviors.
I thought I was going crazy. I was hallucinating, I was seeing things, I was hearing things. While I was on the medication, I felt like that was what was supposed to be going on. I had no idea what would happen to me, what other people would think, because that's what I thought was the normal thing.
He told us that he'd seen dark figures and heard voices while he was sitting in class at school. We also were found out through deposition by a friend of his that he had told her that he'd had a terrible, horrible nightmare about going into school with a gun. And this was a year before he actually went into school with a gun.
There's a direct link and association between psychotropic drugs and violent behavior. As the Archives of General Psychiatry said in 1973, stimulants can cause impulsive murderous violence, such as we're seeing today with children going into schools and shooting their classmates in prayer groups.
In Dallas, we had 2 children on Paxil this summer, a boy 10 and a girl who just turned 15, who stabbed their 6-year-old brother to death and buried him out back. Both kids on one of these drugs.
The majority of these children that have gone on shooting sprees, Conyers, Georgia, Paducah, Kentucky, Columbine, and Colorado, these children were on psychotropic drugs.
My name is Mark Taylor and I was shot at Columbine High School in Littleton, Colorado. I believe that they did this because of the adverse reactions to the drug Luvox.
And I can tell you that Eric Harris took Luvox on the day that he did the shootings, or perhaps the night before, because he had a normal effective level of Luvox in his blood on autopsy. I have seen the data.
I was shot outside the school. I was with 5 or 6 of my friends when it happened, and we were just sitting down talking. And about 10 minutes later, I got a shotgun in my leg, hit me in the leg, and then the killer went over and shot Rachel Scott. And he came back and shot me 5 or 6 more times in the chest. And he threw 2 pipe bombs in the parking lot. and then he went downstairs and shot someone else, and he proceeded on into high school.
I found a clinical study reported in the literature in which a child, while taking Prozac in a clinical trial, developed fantasies of murdering his classmates and being murdered by them. These fantasies and nightmares became so real that the child became confused about what reality was.
I'm gonna pull out a goddamn shotgun and blow your damn head off! Do you understand?
Prozac is closely related to Luvox.
I was laying on the ground, and I was praying to God for him to someone to come help me, because it took the police so long to get there. A half an hour later, a police car finally showed up, and he was providing me cover. And another police officer picked me up, and he put me in his car and took me to the triage. He saved my life.
These are things that are discussed in the back pages of journals, periodicals, textbooks, and then when we see them on the news, we're somehow told that, well, these kids were bullied. It's because of the way that they were brought up. It's because of they didn't have self-esteem, or guns were readily available. The problem with that is we're not looking at what drove those children to pick up that gun, to decide that all of their classmates needed to be killed. And what we're seeing is a result of the administration of psychotropic drugs to children.
Doctor told us that he thought the drug Prozac would help Jacob, that it's a common prescribed drug used in teenagers now, that he thought it would help him with his moods and just make him feel happier. So he was put on Prozac that afternoon, 10 milligrams. The morning of my son's death, we had talked that morning. He did not want to go to school that day, and he just said that he would go the next day. They were getting out for Christmas holidays. I left for work, and a few hours later I began to call home, because with him being at home by himself, I was concerned, so I did not get an answer. And I continued to call for a couple of hours, then I left, and it took me 30 minutes to get home, and I found my son hanging in our attic. My husband and I attended a FDA hearing in Washington about the side effects that can happen with these drugs, and unfortunately the first hearing there was 65 parents there. Their children had died while on antidepressants. Some of them were on the drug a matter of days before they committed suicide.
There is also evidence linking antidepressants and suicide in adults.
After being on Prozac for 21 days, my wife shot and killed both of these two boys right here. She turned the gun to herself and shot herself twice. Now she's in jail for murder.
Since I've been on Prozac, I've experienced the following adverse reactions. A drug-induced insanity that has caused several self-destructive outbursts. There was an extended period of anger, rage, and hostility, and it turned into terrible feelings that suicide was the only answer.
This is hard for me because I tried to commit suicide in front of my 5 children. I didn't know what I was doing. I don't remember exactly what happened. All I know is that my husband took the gun away from me and my children was looking from the other room. What would have happened if these children had seen their mother commit suicide?
My sister did commit suicide in front of Lindsay. Another woman spoke of hollow point bullets. That's what my sister used to do it.
Children who are the most energetic, the ones who have that creativity and energy, many of those children are getting into a lot of, quote, trouble because they're not falling into the groove. They're not falling into the pattern. They want to know. They can't wait their turn. They're raising their hand. You know, that's not fair to them. I mean, what should be happening is that energy that they have, which is so beautiful, should be channeled. And it should be channeled into a direction where they can create with that and use that in a positive way instead of it being used against them, that they're not following the, quote, norm.
This one can chew, and this one can do fireballs. And this one can do this. This one doesn't go down, but this one does. It goes like... I'm asking you for just loudness. That's what it does. They're double shooters.
Approximately 10% of boys from ages 6 through 12 or so are taking psychotropic medication. And this is just an appalling statistic to me as a parent and as a physician.
I knew, and I think people know, that they're not okay, that there's just something is awry, but there's nothing you can do about it.
All I can say is these children are put on these drugs for reasons that are so unnecessary. These are psychotropic drugs that have deadly side effects to some children, especially children that do not need to be on them.